We are a group that represents over 100,000 providers, manufacturers, and probably our most important constituency, which we're going to be represented today, are patient groups who rely and benefit from advanced medical imaging. AMIC is an avid advocate for policies that make healthcare more accessible, enhance quality of patient care, and reduce the inefficiencies throughout the system. We are proud to work with more than 22 patient advocacy groups across the country, spanning various disease states, who join us here today. Medical imaging and radiation therapy technologies have revolutionized the healthcare industry. No one questions the value of imaging and its role in diagnosis and treatment of healthcare. In fact, the New England Journal of Medicine proclaimed medical imaging as one of the top developments that changed the face of clinical medicine during the last millennium. But I don't need to tell, especially this group, that. I know each of you intimately understands the importance of access to medical imaging to help you, your doctor, see the cancer you're fighting, to help determine and execute the most effective treatment, and to give peace of mind to your disease remission, and more importantly also to your families. Today, with the support of over 50 patient advocates and more than 20 advocacy groups, the Access to Medical Imaging Coalition is submitting a letter to Congress urging policymakers to preserve the access to life-saving medical technology and radiation therapy treatment. In spite of the demonstrated value of medical imaging, Medicare reimbursement to access to medical imaging reimbursement has been slashed 8 times in the past 6 years. There hasn't been a regulation on the regulatory basis. So that was legislative 6 of the last time, but on the regulatory basis, there hasn't been a regulation issued since 2005 that hasn't cut medical imaging through administrative and executive branch efforts. Bush or Obama, there's one thing that's united, unfortunately, that the reimbursement for these important technologies continues to be targeted by policymakers and folks in the administration. More roadblocks for millions of patients. That's what these legislative proposals entail. The fact of the matter is patients simply cannot afford to lose access to critical imaging services through reimbursement cuts, artificial barriers to care, such as RBM and prior authorizations. These are basically bureaucrats that are going to be put in place in between you and your physician and help determine whether you need that critical scan. Unfortunately, the new data of imaging, for folks who are joining us in person, you can see the slides to the left. Imaging utilization for Medicare beneficiaries has declined by 12% in 2009. Spending for imaging services for each Medicare beneficiary has dropped by almost 17%, 16.7%. Medical spending for non-imaging services has grown by 21.3%. Medical imaging is the slowest growing component of the Medicare system today. Because of these onslaughts of cuts, patients are losing access to these critical services. So this morning I stand in awe of the patient advocates we have today. And Erica, Andrew, and Sheila, our day wouldn't be possible without your participation, and more importantly, the troops that you brought here today to talk to Congress and their staff. By keeping your members of Congress up to speed on the important issues isn't just a single day's work. It's something you care about all year round. At home, by engaging your friends, family, in the cause, and through social media. That's why Access to Medical Imaging Coalition has launched a Facebook application, facebook.com, Right Scan, Right Time, to highlight the lawmakers' importance to access to medical imaging. We invite you to check it out and pledge your support for this important cause. The bottom line, if Americans have access to the right scan at the right time, millions of unnecessary deaths could be prevented. We could prevent many of these costly interventions that unfortunately are only available to you if you're in your last stages of cancer. Stage 1 cancer is easily and can be treated, and it's much more at a human cost, a lower human cost, and as as a public policy, a lower cost, if we prevent and have early detection of these severe diseases. Thank you for joining us today and for helping communication to this important message to Congress. Sheila, I want to turn it over to you to introduce yourself and talk about the lung cancer line. Sure.
I'm not sure this is on right now. Thank you, Tim, and thank you all. Thank you especially my fellow lung lung cancer advocates, Phyllis, Kathy, Red, Dusty, wherever you are. Thank you very, very much. I'm with the Lung Cancer Alliance, and this is the only national advocacy organization solely dedicated to patient support and advocacy for those with lung cancer and those at risk for the disease. The right time, at the right scan, and the right time for the right scan with lung cancer is right now. So let me just tell you a little bit about how imaging is so important to lung cancer. Very quickly, it's the leading cause of cancer death in the world, in the United States, in every ethnic group, women and men. More deaths from lung cancer each year than breast, prostate, colon, and pancreatic cancers combined. This is huge. 3 out of 4 new cases are being diagnosed in people who never smoked or who had already quit, often decades ago. The 5-year survival rate is still only 15%, about the same as it was 40 years ago. Only 16% are being diagnosed at an early stage when lung cancer can be treated and cured. The majority are diagnosed so late that treatments are expensive, very difficult, limited,